Okay, welcome everyone. We're going to go ahead and get started. I think I want to start out just by doing some introductions today. No, most of you probably don't know me. And then I'd like to make sure that we know who's on today. We are recording this webinar today so that we can provide it to other LEAs who are not able to be present today. So just to quickly introduce myself, my name is Tanya Albornoz. I work for the State Board of Education as a prevention specialist right now, assisting Christy with the mental health screening grant. And then Scott, if you want to go ahead and introduce yourself.
Sure. My name is Scott Ayer. I work for the Division of Substance Abuse and Mental Health, and I am the school-based mental health specialist and act as a liaison with the Board of Education for things like this.
Yeah. And then Christy, if you want to introduce yourself.
Yeah, hi, Christy Walker, Safe and Healthy Schools Coordinator at the Utah State Board of Education.
And then if we could just have you provide us with your name, your position in your LEA, and maybe how long you've been working there, that would be great. And the name of your LEA, of course. Let's start with Kurt.
Dang. I'm Kurt Jiggins. I work in Cache School District. I'm the Director of Student Services and miscellany. And I've been working here for 65 years. That's just this year.
You win.
Marianne, how are you?
Let's go, Marianne.
Oh, yeah. I'm doing good. I saw you on here and I was so glad because I so miss meeting with all you guys.
I'm also here with Debbie Reese. So she's in my office, and Debbie is our project aware manager for that.
Okay, perfect. Marianne, do you want to go next?
I can. I'm Marianne Oborn. I'm with Tooele County School District. I'm the Director of Counseling and Social Services. And I'm like, Kurt, I've been here forever.
Awesome. And then Katrina, do you want to go next?
Sure. I'm Katrina Walker. I'm the director at East Hollywood High School. And I feel like I've been there forever too.
Awesome. And Tina is one of our support staff at USBE. So she's helping us navigate all the logistical things today. Go ahead, Tina. You want to introduce yourself at all?
Yeah, I'm Tina Morandi. I'm the Executive Secretary for Safe and Healthy Schools. Since we're saying how long we've been here, I've been here for just over 20 years. And probably you're right. It feels like the last year, I'm ready to retire now with 65 years in. So I hear you, Kurt. Hi, Marianne. I'm just helping. I am the support staff for this grant. So if there are any questions with the application itself, getting it turned in, such like that, I will be the support staff for this grant.
Yes, perfect.
And I
Thank
turn
you.
my video off or I get shut down. So.
Okay, so the purpose of today's grant is just to kind of review the application and answer any questions that you have about the grant application. We're going to do that first. We're going to go through the grant application and talk about that. So if you have other questions that are not related to the grant application, maybe not that maybe other parts of the process, we're happy to answer those at the end. But what we'd like to do first is just go over the grant application itself. And if you have questions, feel free to put those in the chat. Tina's going to be monitoring the chat today, and she'll let us know what those questions are. But then at the end, we're going to have plenty of time, I think, to open up our mics and just have a discussion or answer any other questions that you might have. And so Tina has pulled up the grant application here. And you can get to this by going to the Safe and Healthy Schools website. And there's a link right to the application. Thank you, Tina. So you can just press on that link and it will ask you to make a copy. It'll take you to the Google Drive and it'll ask you to make a copy of the application form in order to fill it out. And that's just so we have those copies specific to your LEAs. So it's specifically designed to have you make a copy of it. So make sure that when you get to that point, you just press yes and choose that option to create a copy of the document. Once you're done and it's filled out, then you would just send it to Tina, I believe, and then she will keep all of those and provide you with an electronic copy of a receipt email from USBE. Did you want to say something about that, Tina?
No, I was just going to say yes.
Okay.
That is
Okay,
absolutely
perfect.
true. What they'll do actually is when you save it, you'll share it with me, so it's saved in that file. But if you
There you go.
have questions about that, and then I'll get an email saying it was sent in. Thank you.
Perfect. Okay, do you want to scroll down just a little bit, Tina? Okay, so there are two parts to the grant application. And I just want to make sure that you know that you do not have to apply. You can apply for one or both sections. You're not required to apply for both sections, but it's at the LEA's option. The first part of the grant application is the mental health screening program itself, and the second part is mental health services support. So we're going to go over these sections with you and talk a little bit more about kind of what we're looking for in those sections. And you do need to answer these questions before you get there about, has your mental health screening participation application been completed? As you know, that was opened and it closed on December 20th. And I believe everyone that's on today, to my knowledge, filled that out. So, and then are you aware of and planning for compliance with parental permission and data privacy restrictions outlined in the rule? And if you need to go to that rule, I think we have it linked a couple times within the application itself. Tina, can you scroll down a little bit? Okay. And then we have Scott's and my information here. And then just keep going and they can see those questions that I'm referring to right now. There you go. And then after that, we have key definitions. So if you have any questions about what those definitions are, we also have links to the approved list for mental health screening tools and the list of mental health conditions that the board has approved for the screening tools to be screening for. So I'm going to turn it over to Scott and let him go through section 1 of the application.
Thanks, Tanya. So section 1, just a brief LEA overview, the application, the name of the applicant, your district for those of you that are applying as a district level, and the application lead contact information for the folks that are going to be overseeing this work. Also a secondary contact. Now, this may be an administrator as the application lead, and then maybe somebody who's a point of contact who oversees the work directly as the hands-on person. Either way, we'd like to be able to have those contacts filled in. Under section 2, the mental health screening program, bullet point number 1, this is really just asking for the tool that you plan on using. Now, it has a hyperlink to the approved mental health screening tool list right there. For the folks that are using that list, items off that list, you can go visit that list, and really it's a very basic answer. If you're applying for a tool that is not on the pre-approved list, you would, first of all, not be eligible to use funds this fiscal year. The reason for that is these new tools have to go through an approval process, and with the time constraints, there just isn't enough time for it to go in front of the full board in order to be approved. However, it's important to note that once the tool has been approved, if you are applying for a new tool, that once it eligible for funds moving forward in the future. Bullet point number 2 is a link to the mental health conditions which the board has approved to screen for. And so just a very quick answer on what conditions those are that you plan to approve, and also any local data, anything that you are using to help you reach that decision to screen for those things. If you're not familiar with SHARP data, that's a great one to go to look for, but also any other information from the local level would be great. Again, brief description, 300 words or less. Mental health screening budget narrative. So under this, we're looking for a brief narrative on how you expect to use the funds. Within this narrative, be sure to include information that supports your rationale, which you'll see in section 4, bullet point number 4 right after this. And please make sure that it also aligns with the budget narrative at the very end in section 5, so that everything aligns. Looking at the rationale in bullet point number 4, here what we're looking for is just, again, another brief narrative on the reason you are choosing to use the specific tools that you are. And again, speaking to why your LEA has chosen to assess for these specific conditions, what data was gathered and analyzed to help inform your decision on that screening tool, and then if there's any stakeholders that you are consulting with or plan to use, please speak to that. If you've already began the process of conducting mental health screening in your school, any baseline data that you might have in regards to the number of schools or students that are screened in your school, or how many have indicated as positive for potential mental health conditions, and what that looks like as far as referrals to outside agencies for services. All of that information would be really great to just include in a bullet point format there, and again, brief response. And then as we look at bullet point number 5, the referral process for mental health screening, it's important to know that prior to any mental health screening, it's best practice to have a solid plan in place in order to know how to triage or address the concerns of any mental health issues that arise. So this plan is something that should speak to what is offered within the school, as well as what your referral process looks like when these needs really extend outside of what the scope of what the school can offer. So speak to that referral process, and also what you are doing to address any of those needs within your school. And then please, 300 words or less, just easy, brief answers. Tanya, do you want to take section 3?
Yes, sir. Thank you. And just to kind of reiterate what Scott said, we tried to make this as easy and seamless a process, and that's why we're giving you the limit to your responses, just so that it's simple, it's more simplified, and doesn't create so much work for you, and also just gives us the idea for your program, since this is a new process. So the next section, like I mentioned, is not a required section. So again, you can choose to apply for this, but it's not required. But it is, if you are going to apply for this section, it's required that you have a mental health screening process, if that makes sense. So this is based off of the legislation. There were 2 different parts in the legislation in HB 323. The first part was just for the mental health screening itself, and the second part was to provide reimbursement for parents who may need help if we provide referrals to relevant mental health services. So the second part is for that reimbursement to parents. And here we're just asking for you to provide us with how the LEA is going to make that determination that the parents meet the definition of a qualifying parent. And that definition can be found in the statute itself, as well as referred to in the rule. There are specific qualifying factors, and so we We just want to know what the LEA's process is for determining that the parents meets that definition. And then how you'll triage parents' needs for the reimbursement. So you might have multiple parents in your LEA that need help. How are you going to triage within the funding that you receive? Maybe which parents' needs might take precedence over another. And then how are you going to provide those referrals? How are those services going to be provided to them? And then the frequency, intensity, and duration of those services for which you'll reimburse. And again, within the statute itself, there are specific qualifying factors that you need to make sure that you pay attention to as you write this section. I saw that there was a couple of questions in the chat. Okay.
Some of them I'm trying to answer without interrupting you.
Okay. Okay.
And get to that part. So if you want, we can just go over it real quick.
Is it specific to this section that I'm going over right now, or is it
ideas of how to use mental health services support area and how be aware grant schools have utilized this? Where's our liability? And then the other one I can answer in the chat.
Yeah, so one thing that you should be aware of is that for anyone that's awarded the grant, we will be providing a training that's required in the statute. It's a joint training put on by USBE and substance abuse, the Division of Substance Abuse and Mental Health. So Scott and I will be putting that together, and we will be going over the technical aspects of the grant, as well as best practices and things that information you can utilize as you implement. So we can talk about that more after we go through the rest of the grant itself. So so this section again talks about how you're going to make that determination that the parents that you'll be providing reimbursement to meets that definition of a qualifying parent. So can you scroll down to the next section, Tina? Number 2. Okay, and then this one is providing a statement regarding the LEA's ability to support and provide mental health services to the student who is identified as the result of the screening. So we want to know what's the availability of the mental health services within the LEA, within the community, and the overall accessibility of mental health services within that community, and then the current student demand for that. And this is something that's specifically required for us to ask you according to the rule. And that's the purpose for this question. And then the last part of this one is to write a brief narrative. Again, explain to us just your whole process for providing reimbursement, and give us that budget narrative that aligns with what you'll fill out in your budget section later on in the application. So then we get to section 4, which is data and evaluation. So Scott, you want to take that over?
So what we're thinking about when it comes to data and a collection and evaluation is the funds that are coming in, we need to answer to those, to the legislature and be able to speak to how these funds are being utilized. And we want to do so in a way that we respect schools' ability to collect the data and only speak to the things that we think will be meaningful in reporting up the chain. And specifically, what we're looking to know is how many students you anticipate to be screened. So in asking for these funds, what is your need? How many do you anticipate? Is this going to be done on a classroom level, a grade level, or is this going to be done in a more of a universal level? Some schools may wish to do more of a targeted individual type screening process, and that's fine. The funds that you request should reflect that. And also, we want to be able to report on the number of students that are able to be screened with the funds used. Also, the method in which you plan to monitor and evaluate your outcomes. What does that look like? How do you plan to evaluate the delivery of your services? Basically, how will you report on, or whether you are or not meeting your objectives. What's the impact? Those things could be things like number of positive mental health conditions that have been discovered through this, connections to referrals, surveys that you may want to do before and after to hear feedback of whether it was or was not helpful. There's a number of different ways, and again, that'll be something that that you get to decide on how you want to evaluate and monitor your own outcomes. And then the last thing is also how the mental health screening data will be collected on your end, analyzed, and then reported. Any plans to use the data to inform or improve your own or modify your own program moving forward would also be welcomed. So just those considerations for data. And within that, we want to keep it simple. We want to keep it HIPAA and FERPA compliant, but we want just overall baseline information. As we see the money available today is helpful, but should this be something that we can request more money for in the future, we would be looking at numbers like this to help support those asks in the future.
And maybe even hopefully expand the programming.
Correct.
The program, the funding with the legislature. So in the right beneath that section that Scott just reviewed, we've also included in the application some elements that we'll be asking you about. So this is not something that you have to cover in your application, but it's just there for your information. These are elements that we wanted you to have and be aware of as you build your program and build out your data collection methods. Just know that we'll be asking you for these numbers in the future so that you can use these to build, again, your way, how you're going to be collecting this data for us. So these are required elements that we're going to be required to report back to the legislature. And then
I do have a question about the screening tools when you get a second.
Okay.
Can they make changes in the screening tools that were selected in the participation survey if they would like to use different tools than were originally proposed in their LEA's response to the participation survey?
That is an excellent question. Christy, are you on? Can you answer that?
You know, that's something we'd have to take back to the committee and send out the answer. So Tina, if you can make note of that question and grab an email from the individual who asked it, then we can circle back, and we can also post that one on our FAQ so that everybody has access to that question and answer.
Yeah.
Yeah.
Okay, so we'll get the answer to that and make sure that everybody that's on today and anybody who's interested in applying for the grant funding has the answer to that question. And the last section on the application is the budget section. And this is just your standard budget section for your mental health screening program. And I'll let Tina speak to the indirect costs. I saw there was a question about indirect costs.
Yes, and right here, it will be, where did we put it? It's your total after you add all this up, section 2, total of section 2, contracted services. Then right here, you're going to have an indirect cost rate. If you do not know your unrestricted rate for your indirect cost, I do have that. Each LEA is a different percent. You'll put what the percentage is here, and then you take the subtotal times it by, add your indirect cost. That's what will be your grand total. So if you know what that is, great. If you do not know what that is, email me and I can get that to you.
Thank you, Tina. So let me just go backwards a little bit here. Can you scroll up just a little bit? So we have two sections on the budget section. We have your totals for section 2. So again, that's the mental health screening program itself. And then we have a budget section for section 3 if you choose to apply for that, for funding for the reimbursement for parents as well. So those you'll need to fill out separately, and then underneath that, if you choose to apply for both, that's where you would put the grand totals from both of those sections. And if you're only applying for one, of course, just repeat that and put the totals for the one section and add the indirect costs, and then give us the grand total for your program. The total amount that we're being provided for this grant is $500,000. So that's not, when we're talking about mental health services and mental health screening, that's not a lot of funding. So what we'd really like to see is that you do a thorough assessment of the LEA's needs, that you provide us with your rationale and as much information as you can so that we can make a good decision for how to disperse this funding. And then the last part of the application is just the signatures, the assurances and the signatures. There's just a few assurances here, and we just want to make sure that you know that we will need all of the signatures in order to consider the application. So is there anything else that you feel we need to say about that, Christy?
No, I think you covered it.
Perfect. So that's, first I just want to ask if there's any questions about the application itself. And then once we go through any questions about the application, then we can open it up for further questions. Oh,
Hey, I couldn't find my unmute on here. It was mixing in with the application screens.
okay.
This is Marianne. And Kurt can maybe answer some of this, because if I understand correctly, you had the AWARE grant in your district. So how have districts been doing the screening? Because for me, as I've been looking at this and putting a rough draft together on it, it was difficult to say, if we're doing screening events at night, what's the ratio of personnel helping people to students? Is there kind of something that other districts have found out that were good? I mean, I have what I was guessing and estimating, but it would be helpful if someone could say, plan on having 50 students in an evening, make sure you have at least 5 or 10 people or whatever there to help you assist with it on it. I'm just wondering, experience from those that have done this and gone through the process of things, some of the things that they've learned of what works, what doesn't work, and maybe some things recommendations even as they've gone through this. And then the other part of my question to me that was like way difficult as I was looking this was the section, I think it was 3 for the mental health services support. I don't even know where to start to even try and guess on that. So it's like, okay, I don't even dare apply for this because I have no idea what that would look like.
Yeah, we for the second part of your question, we realize that this is a brand new program and we're all just starting out here. This first year is gonna help us inform a lot of how we move forward in the future. I'm very sympathetic to that. I just in hoping that Kurt and maybe some others can give you some insight and some of their experience on that.
Yeah, that's a lot of pressure. Are you planning on using the whole $500,000, Marianne?
Absolutely. I wasn't going to share any of it.
Because you're going to do a lot with that. So I think of the 3 districts that are aware, like we do it a little bit different than Alpine and Jordan. They do. We screen, and I'm going to have Debbie tell you how we've done it, especially this year with COVID, which has been a little different, but actually has worked out maybe a little bit better than what we've done in the past, surprisingly. But we have screening nights, so more than one night now because it's been online. you want to add to that, Debbie, what we've done?
Yeah, so we contract with Bear River Mental Health. So we send students that are interested and parents that are interested the survey. They take it prior to the screening. Then they indicate whether they wanted a virtual, like a telehealth session with a therapist, or if they chose to come in person. So we had both options. And like Kurt said, we went over several nights. And we liked it because it turned out there were very few people in the building during the screening, which seemed to be more comfortable for the students and their parents.
So if you sent and I didn't know if we could legally send the questionnaire to them prior to the screening. So if you send them, then.
Yes, it's we have a link when they register, they get the screening tool, the student and the parent complete it together, and then the results are given to Bear River Mental Health. And then they go over the screening with the student during their session.
So then Bear River sets the time, because I
do the time. I set up a schedule so that we don't have any overlap. That's one thing we've learned, that we didn't want students in the building from the same schools and etc. So I set the schedule so there's no overlap. And yeah, it's worked out well where we've been able to expand it to several nights.
How much time do you allot for Bear River people to meet with your?
Each student gets 30 minutes with the therapist. And we allow a 15-minute break between, because some of them tend to go over a little bit. So they get a minimum of 30 minutes.
Okay. And so do they do that like the intake for them to then do further services? Or
Yes.
Yes.
Yeah. And I don't know if you guys know that or not, but with COVID, there are some additional fundings
Yes.
from health departments
Yeah,
to cover some of the costs.
Yeah, if they determine that the student's anxiety or concerns are related to COVID, they have a grant. They've been able to service the students.
But I'm with you, Marianne. I don't know if I would touch that second part with the 10-foot pole. That seems, I don't want to get into the insurance business, and we'd have to hire just a full-time person to deal with paperwork and stuff like that. And I'd like to see how that's actually done. I don't know if I would touch it.
I mean, I like the idea of people having the ability to access support that's higher level than just our regular therapists, because we obviously have students that need that. But man, the cost on that could wipe out that 500,000 right off the bat on one kid.
Yeah.
Yeah.
Depending on where their needs were at.
You know, there are some options that you might want to look at. Like there might be some situations where you're waiting for a parent to qualify for Medicaid, and there's just that time period between, or you know, you're trying to help them through find some other mechanisms to pay for it, and you just maybe need a one-time reimbursement. There's just maybe some stopgap measures that you could utilize that section for that funding for in some very what am I trying to say? In some very limited circumstances. So that's just something for you to think about.
Can we see how it goes and then ask later?
Absolutely.
Because I mean, I have my mental health grant funding, and that's what I was figuring that I would go ahead and just use, so that after the therapist met with the parent and student, which I definitely want to talk to you more on this, Kurt, that then they would have a form filled out that would go to my counselor so we can fill out and do our services as we have outlined for that. But I have no idea what I'm walking into here to know how many people are going to turn around and I'm going to need to be requiring more services for. I don't know how many people are even going to want to do the screener. Time to outline everything out. Kurt, how many therapists do you guys, or Debbie, how do you guys use in an evening? And how many students do you screen in a night?
Right, well, we're a smaller district, but.
They're about the same size.
Oh, I
Mayor.
don't know.
She's
Okay.
Tooele.
Oh, yeah. Okay, so Bear River, we have 3 therapists each evening for sure. And then depending on the schedule, we've had up to 5, but a couple of them were on computers with students. They weren't all.
Yeah, like
in
telehealth.
person. Right. And so we were able to do a screening this last October, and we screened 38 students.
38 a night?
38 in 5 nights.
38 in 5 nights.
Right.
Well, that's huge different than from what I was kind of hoping I could do. So that's the kind of stuff I need to know.
But also, just to let you know, this when we've done this in the spring, our numbers have been much higher in the spring. So,
have you looked at using your school counselors for any of this, or are you only using your therapists?
well, right now we're just they could do that at school if they want. I mean, the tools available, they could do that. But I think for the most part, we see that parents like the anonymity of going directly through Bear River through therapists
Okay.
rather than their counselor. So it's been a better fit for us than at the school level. At least right now it has been. But we just have a good partnership, and so that's really worked out for us.
I've got good partnerships with several of our local agencies that I work with daily. And so I'm not a concern there, but I do know that my cost to hire a therapist to come in is much higher than if I have counselors come in and help with some things and then refer on over. That's kind of, and I was thinking bringing the school counselors in at night, not having the parents go in and meet with them during the day because of that anonymity.
Yeah.
Because I totally agree with that and trying to figure out how to do that. So do you have like a classroom assigned to each therapist where they go to meet? So, or do you have counselor offices or?
They actually come up here to our building, we're off campus. So it's not a school. Then we just use offices.
Okay.
I'm happy to talk to you about it if you want to call me.
Yeah,
an outline of how we've done
Debbie's got some flyers too, if you're interested in looking at those.
We've had community partners come as well. We have a different room where they have come and set up with their own resources. They bring things to give away to the students, just like stress toys and treats. And it's just a way for them to exit the building through a different room and pick up some things on their way out.
Okay. What's your phone number, Debbie?
What is it? So
this is being recorded statewide.
Do you want? Do you want to put that maybe in the chat?
Kurt has all that information on me. Kurt, would you give her my information?
Yep, I'll do that.
Yeah.
I will say a lot of what is being discussed, I think we hope to cover in our February training. This is really good information and things we need to be considering. Jumping back to the mental health services support in Section 3, I think there is a comfort for some folks that those funds may be available to help bridge gaps, maybe in the process of connecting with Medicaid or with identifying parents who qualify through things like free or reduced lunches may also be measures that are already in place that kind of help us in that direction. So if you're thinking that is a section that you don't want to dabble in, that's fine. But if for those that want to, is an opportunity to use funds maybe on a one-time basis or in a way just to help to know that they are there for you, so that when you are having a plan in place to triage and to move students who need help into further assessment and diagnostic type treatment, that is some funds that are available to help support that. So they're there.
Yeah, there's always those very unique circumstances that come up that you might need to provide a little bit of support to the family or to the parents to assist that student. And it's to have those funds available for you for that purpose.
So a further question on that one then. So because I know the main focus is on the mental health area for this is depression, anxiety, suicidality. But what if I have a student come in high anxiety and I find out they have schizophrenia or multiple personality disorder or some major things like that? To me, that's
So
I was looking at this, I'm like, ooh.
Sure. Marianne, I think to myself, that is not necessarily what this is intended for. I don't think we are screening for those things. We're screening for the first step. And if there is a positive or a red flag type scenario where that score indicates as something that needs further assessment or treatment, that would then be further down the road. But we aren't going to, or I should say this, the board hasn't approved for schizophrenia to be something that we screen for up front.
Yeah, and I'm not saying it as that's what it'd be screened for, but in the process of going through the screener list, because if you do like the child behavior one, that's pretty thorough, that it could be used as an intake, that it could flag some other things as I was reading through it, that I could see a therapist then asking additional questions that may, as I'm working with a student here, brings out some oppositional defiant disorder or some of these other areas. And so that to me was on that mental health services support. I'm like, so is that supposed to help with those extreme kids? Or is it just to help with the kids that we're already working with that are suffering from depression, anxiety, and suicidality?
So there's a difference between mental health screening, which is widely available for any student and parent who wants to opt into it, and a mental health assessment, which as an assessment is if you have some indication that there's already a mental health issue, that's considered an assessment, and that's outside of the scope of the purpose of this particular grant and legislation. And the grant wouldn't necessarily be able to support the assessment side of it. And one thing that I neglected to mention and meant to early on in this webinar is that we have an FAQ document. And Tina, if you want to pull that up, on the Safe and Healthy Schools website, you can access the FAQ document.
Before we do that, can I just, there was a question that I was just waiting for that conversation. If they're a charter school, not part of a district, can they still apply? Which, yes, you can apply as an.
And I reached out to
Did you?
Susie in the chat and
okay.
Gave her my information to connect with her.
Just wanted to make sure you got that. All right, I'll share and get the.
Okay.
FAQ
so we do have an FAQ document of multiple questions that we've already received from LEAs regarding the participation application as well as the mental health screening grant program. And this has some great clarifications in it as to what would qualify under this and what doesn't necessarily need to qualify under this, and what the difference is between screening and assessment and crisis intervention, because those are three different things, and also answers some of the other really common questions. So we wanted to make sure to let you know that this exists. It's out there for your information. And then if there's other questions beyond this, send those to us. And this is a living document. It's meant to be something that we continue to add to as we get questions from you. And also, if you have a particular situation that you want to discuss with us, Scott and I are really open to you contacting us, and we can talk through it with you. We're just here and available to answer those questions. So, but as you can see, number 3 kind of addresses what you were talking about, Marianne. It talks about the difference between screening and assessment and crisis intervention. And if you have determined that if you've already made a determination that a student needs to receive some kind of mental health treatment or intervention, that's outside of screening. You've already made a determination. The screening by that point is null and void because you've already made that determination. So if that's the case with a student, then it falls outside of the purpose and scope of this particular grant and process. So.
Okay, thank you.
Do you have anything to add to that, Scott?
No, I gave you the smile and the emoji thumbs up. You did a great job on that one.
Sorry, you're like this big on my screen. So
Nope, that's great.
are there any, what other questions do you have about this process? And as I mentioned, there will be a training. So for any grantees, any LEAs that receive the grant, there is a required training that we're looking at providing in February, and that will be required for whoever the main, what did we call them, Scott? Whoever the main grant administrator is within the LEA. So just be aware of that requirement as well. Are there any other questions?
Was this already asked? Sorry, this is Kurt. When would funding be available to districts? Do you have a timeline on that one?
Great question. Christy, are you on? I think as soon as we are able to look at the applications, I think my understanding, Christy, correct me if I'm wrong, is that the funding is there. We weren't sure of the funding until recently, but we have it. And as soon as we are able to look at the applications and make the awards, we would be able to push those funds out through Utah grants.
Thanks.
Yeah,
Is that
not on. So what will happen is after the applications are reviewed and approved, then I have to submit them into Utah grants. And then once Utah grants approves it, that process can take 1 to 2 weeks. Then they'll send out the award letter, and then you can use your funds.
Yeah, and we are aware that this is a really shortened time frame, as these funds would have to be expended by June 1st. June 30th. But that's the timeline we're working with right now. So,
hey, Tony, this is Kirsty. I'm having a hard time with my mute. So as far as that question with the reimbursement or the expenditures, so the funding, once you're approved and it hits, it's actually retroactive. That was awarded, for this fiscal year. And so it may take some time to get through Utah grants, but keep in mind, if you spend it before the funds are loaded, you can still receive the reimbursement. So
yeah,
hopefully that
July 1 of 2020 to June 30th of 2021, I believe it, right, Christy?
correct. Yes.
So we just need to wait for the feedback from one of you to tell us that our grant plan has been approved. We don't need to wait for Utah grants letter to come through, because sometimes that can take forever.
Yes.
Yes, and we're going to be working as quickly as possible to make sure that we get those awards out to you, or to notification of award out to you. Are there any other questions?
And I'm assuming we can, because I'm on some of these, that's like, I just, I was wanting maybe just to do a phone call or something and just say, hey, this is what I'm thinking of on this section. Am I in line with what the state's wanting to see here?
Yeah, we can answer your questions as best as we can. Yes, either Scott or I, you can reach out to us.
Okay, just because some of this is a little bit, like I said, it's new territory.
Yeah, and again, this is new territory for all of us. This is a new program, and we understand that this first year will be used to work out a lot of the kinks and the work, try to work through the process and the barriers, and hopefully by next year, everyone will have a much better idea of the needs and what we're talking about. So we're very aware and cognizant of that. know that we'll be aware of that as we go through the applications.
Okay.
Any other questions or anything you want to add, Scott or Christy?
Nope. If there's no other questions, I think we'll take questions on a case by case. Reach out to us. We're more than happy to help. This is important, and we will make it priority. So.
All right. Thanks
Also,
to all
note frequently asked questions. They will be updated continually, and they are on that website. So you can click on that anytime for frequently asked questions, and additional ones will be added to the end. If you have any of those.
Yep. So Scott and I will stick around until everyone's gone in case you have other questions that you think of. But other than that, thank you so much for joining us today. I appreciate the questions and the conversation. And Kurt, I appreciate you answering Marianne's questions and being available for any other LEAs that might need a little bit of help here. So
I will be in touch with you, Kurt.
thank you all for coming.
Yeah, thanks everybody.
Great day, you guys.
See that.